Welcome to the Goizueta Business School Learning and Leading Distinguished Speaker Series. This series is brought to us by Dean Karen Sedetall, and I'd like to thank the Dean for joint venturing with the Robson Program for Business, Public Policy, and Government. John Robson was a dean of what was Emory Business School. I'm Professor Jeff Rosenzweig. I direct the program. I'd like to thank the Grant family because this is also part of their Distinguished Speaker Series within the Robson program. Well, today, as you've read, we have a very special distinguished speaker, Dr. Helene Gayle. Helene has an MD as well as an MPH, and she's one of the world leaders in public health. But after being the head of infectious diseases and much of CDC, and being at the Gates Foundation and heading up with what they were doing in vaccines, she was CEO of CARE, a multi-$100 million global non-government organization. And now, being more interested right now in wealth inequality and income inequity and health inequity, she's at the Chicago Community Trust, which has an endowment of almost $4 billion that they spend out of that to work on issues in Chicago, which I believe has the greatest inequality in our nation. But Helene is trying to be and is a catalyst to try to make the situation better. So Helene is on the board of Coca-Cola, Colgate Palmolive. I'm just going to turn it over to her. Helene, great to see you.
Great to be with you.
And I'm going to lead right off with a question. But before we get to wealth inequality, let's talk a little public health. Do you see this pandemic becoming more endemic fairly soon? And do you see that do you forecast there'll be pandemics in the future? And a lot of people say we weren't well prepared for a pandemic. I think budgets have been cut since you were at CDC, et cetera. Do you think we will be better prepared, the U.S. and the world, if there are future pandemics?
Well, first of all, thanks for inviting me, and it's always wonderful to be with you. And you never pick small topics, so let me try to unpack that question a little bit. So part of it is around our preparedness, and then I guess the other is, what can we actually expect? And I think in many ways, one, if we've learned nothing else, it's throughout this pandemic, it is to not be surprised at a twist and turn that may come. So, we don't know. That said, I think it is, at least here in the United States, moving to, probably what we would call kind of an endemic situation where we will be living with COVID. It looks like potentially the variants as they will continue to be less severe, cause less severe disease, but maybe more contagious, as we've seen with Omicron, which is
Right.
less severe, but more contagious. I think we're all starting to recognize that, we have to figure out how do we live with this. And so there's a lot of lessons from the last 2 years that I think we can learn. First of all, if you feel sick, stay home. If you know that you're going to be in a crowded situation, wear a mask, even if it's not at the height of the pandemic. All these things, wash your hands. Many of us don't even shake hands because
That's right.
it's long before COVID. We knew that people sneeze and cough and other things in their hands, and so it's probably not the safest practice in any event. So I think there's a lot of things we've learned, and yes, it does seem more likely that we are going to be in some sort of a low level of chronic infection, that we will all learn how we deal with it, what's the risk that we want to take, and how do we protect ourselves. In terms of preparedness for the next pandemic, because I think it is safe to say that it is very likely that we will have some new emerging infectious disease over the last several decades. We've probably had 40 new infections, SARS, H1N1, Ebola, et cetera. We've had viruses that have emerged, and they probably very likely that that's the world we're living in, where we're going to continue to have emerging infectious diseases. And I think it's fair to say that we were caught flat-footed. We could have done a much better job in many, many ways. We could have done a much better job by having the public health workforce that's necessary to be in place when something like this happens, not to have to scale up after the fact. We would never let our troops uh, go home and take leave, even if a war is not going on. We keep a certain troop strength because we want to always be prepared. We always want to be ready. It is more likely that we're going to have biologic threats than we are going to have traditional military threats. So we could take a page out of that book and make sure that we have a public health workforce that is ready at all times, that is looking at preparedness. We need to have strong surveillance systems so we actually are able to chart and know when an unusual appearance of a infection is starting to pick up. And so, to be able to have that surveillance, and once we know that we have something that is unusual happening, being able to track it so we know which populations are at greatest risk. We need to have strong laboratory capacity that we didn't have necessarily. And we've got to have better coordination, because I think in many ways, one of the real challenges this time was the lack of coordination, the lack of consistency in messaging. And we know that in the early parts of this, there was a lot of fear and confusion because messages weren't as clear as they could have been, weren't as coordinated. So those are the kinds of things that I think we need to do to make sure that we have the right people in place, the right systems in place, and that the coordination among the different agencies that all need to be involved in this is in place.
Yeah, and as you speak, I think kind of a cost-benefit analysis. We were probably trying to save millions, and trillions of dollars were lost on the world economy as well as lives. We'll turn for a minute to vaccines, because you've done so much with vaccines, Gates Foundation and other places. And I believe on behalf of the nation's National Institutes of Health, you kind of co-chaired a task force when the pandemic broke out to think about equitable vaccine distribution. Could you talk about vaccine distribution on the U.S. base, and do you think we'll be ready again for an efficient and equitable vaccine distribution in the future, and also on the global basis? A lot of people said variants will break out in other parts of the world if people don't get even one jab. And here we are wanting a second jab or a booster even before others get one. On the other hand, a booster sounds like it's quite useful if you get Omicron. So could you give us a little bit of your views on vaccine distribution?
Yeah, so as you mentioned, I was part of a task force that CDC and NIH commissioned. They asked the National Academies of Engineering, Science, and Medicine to do a report. This was a group of independent scientists, all range of backgrounds, to come together. And this was before we had a vaccine, but we knew that in the early days, there would be more demand than there would be supply. And so to really think about what would be an equitable way to distribute what at that time would be a scarce resource. Mm-hmm. And we put together a framework that really looked at a risk profile, a risk pyramid, if you will. Who was at greatest risk for acquiring COVID? Who was at greatest risk for having serious consequences? And really kind of put that together in a way that would allow for a phased approach to getting vaccine out, with the idea that once there was enough supply, everyone would get it, but who should get it in the beginning? And really looked at that with a lens of equity. And that was part of our charge, was to look at this from a lens of equity, because we know that COVID was disproportionately impacting the elderly, and we saw that very early on, but increasingly communities of color were most hard hit by this pandemic. These were oftentimes the people who were in jobs that put them on the front lines, oftentimes people who lived in substandard housing, where the idea of being able to isolate and social distance was just not a reality. And then many communities of color also had disproportionate disease burdens, diseases that put people at greater risk for severe consequences if they in fact were infected. So we looked at all of those things and really put together a framework that um, prioritize people who were at greatest risk of either getting the disease or acquiring the disease, and also use CDC's social vulnerability index to really target neighborhoods and geographies where all of these social determinants of health, if you will, housing, uh, foreign language speaking, lack of access to transportation, lack of income, all of these things that put people at greater risk because of the social environments in which they live in. And so we wanted to make sure that in all ways we were prioritizing the people and the communities that were at highest risk. Now, did it roll out as equitably as we wanted it to? No, but at least by starting with a framework, I think we did a better job. And when the advisory committee that advises the CDC, the ACIP, did its framework, they used a lot of our principles as they were thinking about it. And so, at least equity was built into the way we started thinking about this. We know that vaccine access has not been equal, particularly in communities that have low access to medical services to begin with. And we also know that the issue of trust has played a huge role in terms of who's getting vaccinated, even if they have access, and who is not. And so, we know we have a real trust deficit when it comes to this, and that has really skewed the not only less the access, but who is actually willing to get a vaccine once it's available. Lots that we could unpack there. I guess I would, just finally say that if we think about it globally, the unequal access is even greater. Here, I think the average is that about 65% of Americans are fully vaccinated. In many countries in sub-Saharan Africa, that percentage is in the zero digits. And so, in the parts of Asia where rates are still very low, 10, 20, 30% of population. So if you look around the world, you see we haven't done a very good job of equity in access, and we have a huge way to go in a pandemic where no one is safe unless we're all safe. It's a global pandemic. It is foolish to think that we can only vaccinate our country and not continue to have some of the things that we've seen as far as successive waves of this pandemic.
That's right. And sometimes people think equity and efficiency are trade-offs, but here equity would lead to more efficiency in terms of stopping variants coming from around the world. People put questions into the Q&A, but I'm going to ask you a quick question about vaccines and then return to something you were talking about, which is the trust, often in communities of color, and even more specifically with Black persons, trust in government, healthcare, based on very real factors, and also some of the specific things you're doing at the CCT. But before I do that, just because of your scientific knowledge, I've been wondering, there's all the talk about the mRNA vaccines, et cetera. And I think they're working on a vaccine that will maybe be effective against more variants, or perhaps even against future. We had SARS and then COVID-19. How optimistic are you that we'll have more kind of omni vaccines that will be effective against a greater range of illness?
Well, I'm very optimistic, and vaccine development is not my area of expertise, so I don't want to go too far out on a limb, but I do think that we saw that the investment in basic science that went into the development of these mRNA vaccines 12, 13 years worth of science that was there and available and ready for us. And so I think that our investments, sometimes we don't always know exactly, when it's going to be used, when a particular technology is going to be used. But the fact that we have this ability as the United States and at the NIH to be doing this cutting edge research, we know it's going to stand us in good stead. It's just another area where I think we have to make sure that we're making the right investments so that when the next pandemic occurs, the next variant of COVID evolves, or whatever it is that we face, that we've been doing the work, we've been looking at it, and we're there and we're ready when the science is needed and the new technologies are necessary.
Excellent, excellent. And I'll turn to people's questions. Remember, people use the Q&A function, and I see more coming in. But Helene, there is that issue of trust. Maybe because we have people on this Zoom from all over the world, actually, maybe explain the depth of this reasons for a lack of trust in the healthcare system and the government on the part of Black persons. And also, it seems like one place where you, as the head of the Chicago Community Trust, are really trying to take active, almost door-to-door actions to help with this issue. Maybe you could get into that.
So we have a long history of poor treatment, lack of trustworthiness, if you will, among people of color in the medical institution and medical institutions. So, perhaps the one that stands out in most people's mind is the Tuskegee experiment, where Black men who had syphilis treatment, when a effective treatment was discovered, that treatment was withheld to be able to see the natural course of syphilis in this group of Black men. Many people alive today don't even know what Tuskegee was all about, but it still looms in people's minds that there was this awful experiment that Black people were experimented on, and that the medical establishment can't be trusted. And while Tuskegee was decades ago, poor treatment of community people of color goes on today. And as recent as the last couple of weeks, friends have sent me articles that talk about this issue of how people of color are treated, how they're talked down to, how they're treated with less than dignity, how they don't end up being referred to the right treatment and have more severe courses, et cetera, et cetera. So, people will talk about some of this historical issues, and I could go into same sort of things with Native American populations or Hispanic. And when we look at a history of sterilization of women of color, et cetera. So there's lots of historical things, but I think what's more important is that today we still have very clear, hard evidence that if you're Black or brown, you're often treated differently. You often are not given the highest quality of medical care. You're not referred to a specialist when you need to. So there is this longstanding, but even current reason why there is this mistrust. We've been very involved. So not surprising that a vaccine that is new, where there's been a lot of misinformation about it, would be mistrusted by groups of people who already have that history and legacy of mistrust with medical institutions. Here in Chicago, we've been working through a grant from the Rockefeller Foundation, as well as funds of our own, on a project really to target communities where vaccine rates are low. And what we found in the beginning was access was an issue. People didn't know where to go. They didn't have transportation. They may not have been able to take off from work. All of those things that are really limiting access. But as things went on, those were no longer the reasons why people said they weren't getting vaccinated. trust came up over and over and over again, even if they knew where to get the vaccine, even if they had transportation to go there, even if they knew that their employers would give them a day off. They didn't get the vaccine because they don't trust the government, they don't trust the health system. So what we've done is to have trusted messengers and organizations that people do have trust in be the ones that are working in these communities. It's not because I go into a community. It needs to be the person, their minister, their head of Boy Scout troop, the barber that they go to every Saturday. But it needs to be people that they trust. And so that's how we're trying to work on this, is getting trusted messengers, trusted messages, and try to get past some of the disinformation and lack of trust that has so influenced many communities of color.
Oh yeah, no, I think that's what you have to do. Like I say, it's with the right people and practically door to door. We've got some great questions, and I'll get to wealth inequality. But one person asked, what steps might you recommend for state governments as they develop strategies for dealing with COVID as an endemic virus? You know, as California recently released their ideas, for instance, as you know.
Yeah, and I think, it kind of back to what I was saying to begin with, and every state's going to have to do it based on, their own population, their own culture, et cetera. But I think we know a lot about the things that can protect you. A lot of states have gone to no mask as long as you can prove vaccination status, or people showing their vaccination status and their test results. Some are doing either or, but I think everybody is recognizing that a lot of this is going to need to be somewhat specific to the situation, somewhat specific to the cultural characteristics of a state, and that we have a lot of things that we can do besides, we know we have the vaccine, but masks still have a place. Social distancing still has a place, and testing. I think we've underutilized testing as an important way of differentiating when people should and should not be together. I test regularly. I mean, I test probably every 3 to 5 days because I am in and out of situations with people. I want to make sure that I know whether I'm infected. I also want to make sure that I'm keeping other people safe. So I think we've got now, the tools, and we just need to put them together so that people have the right information, understand how they keep themselves at low risk, but also make sure that they're not a risk to others.
Interesting what you say that we undertest, because as you know, Hong Kong suddenly has a breakout and they are going to test dramatically. And that must be the answer. This is from Paul Town, who someone you may know, but Paul asks, a wonderful person who also worked at Emory, but what have we learned, if anything, through the COVID pandemic about how to avoid politicization of public health communication?
Well, I think that what hopefully we've learned is to not have politicians giving public health messages.
Yeah.
I think it's important that we have the right, just like I was saying about communities of color, we all need to have the right messengers, and the right messengers are people who are public health people, not politicians. And I think that the more we rely on the people whose role and jobs it is to protect our health, the better off we'll be and the less politicized. And I think we all know that this unfortunately started out in very political ways. Things like masks were politicized, things like vaccines were politicized. And I think we need to get back to common sense public health principles and have those messages delivered by public health people.
Oh, I agree. And people put your questions in. I do want to get to the inequality in Chicago that you're facing now. I there's Evanston where Northwestern is. So that's the North Shore where people are wealthy and they're on the lake. And then there's the most poor areas, very obviously racially segregated. Chicago's, as is Atlanta, as you know, you were here for many years helping run CARE and running CARE and helping run CDC. Could you give us some metrics? Like what is the difference, let's say, in life expectancy between the very wealthiest parts of Chicago and the very poorest, and then a number of the health determinants, social determinants, economic determinants, because I think the gap in Chicago is probably bigger than the gap between the U.S. and some of the poorest countries in the world, average life expectancies. So maybe you could tell us about that.
Yeah, so a study was done here not too long ago that looked at the life expectancy in a white neighborhood, kind of in the downtown, gleaming downtown area, and a neighborhood just about 5-6 miles away, and saw a 30-year life expectancy gap. 30 years. It's the largest one in the country. There are others that aren't very far behind. I think DC has a 25-year life expectancy gap. But the fact that here we are in America, the United States of America is still the wealthiest nation on the face of the earth, and that we have these sorts of gaps in some of our most modern cities is just, it's jaw dropping and totally unacceptable. And as you mentioned, a lot of that has to do with the social determinants of health. And we now know that probably 20 to 30% of your health outcome has to do with health care, and somewhere between 60 and 80% of what determines one's health outcome has to do with what we call the social determinants of health. Whether you have a job, whether you have stable housing, whether you live in a neighborhood where there's access to fresh groceries, whether the air you breathe is clean, whether the water you drink is polluted or not polluted, all of these sort of things, whether your neighborhoods are safe. So these are the factors that really influence more than anything else. So I'll often say access to health is necessary but not sufficient. Yes, we all want to have access to health. We all want to be able to go to a doctor and have regular care. But these other things actually have a greater determinative impact on your health. And those are the things that we're now working on where I am in Chicago at the Community Trust.
You hear these phrases like food deserts, like you say, where they can't get anything like fresh food or something. And I would assume some of those aspects is why Mississippi, both as a state, has the highest proportion of Black persons, for instance, and also by far the lowest life expectancy. Again, it's some of these social determinants, and is the poorest state. So coming out of that poverty, we see some of that in Georgia as well. Now, let me ask about something that's very, I think, integral to your head and your heart right now, which is wealth inequality, something that you're working on. And in your, I think it's your LinkedIn, but I read a lot of very useful articles that you post there and your own writings. And I'd like people to turn to that. Maybe you could show us some places to turn to learn from you and learn from others. But you have taught me in our friendship that wealth inequality is even much worse than income inequality. And if you take, say, Black persons, Hispanic persons, Native American persons, they have much lower incomes than, let's say, non-Hispanic whites, but that wealth inequality can be factors of like 10 to 1. Could you explain more about wealth inequality and why it's so extreme, maybe some of the inequity that has led to it?
Yeah, and so, I think income is the thing that people think of perhaps more commonly. We all get an income. If we work a job, you take money home. Take money home. But you've also heard that expression, living paycheck to paycheck.
Yeah.
And there are so many people who may have an income, but have no assets.
Yeah.
Income is a slice in time. It's a point in time.
That's right.
But wealth and assets are what you take with you. It's what you use to hand down to your children. It's what allows you to have money for a rainy day when your car breaks down. If you have wealth, if you have savings, if your child wants to go to school, you can send your child to school because you have things that you have accumulated. And so this wealth gap is really where we put our focus, and we put our focus on that, but because it's in many ways it is the biggest factor that determines so much else in life and so much else in neighborhoods. We've got a problem with violence here. It's a major problem, and we do some work on violence. But underneath that, if you talk to any young man involved in crime and violence, most often he will say, if I had a job, I wouldn't be in the streets.
Yeah.
If I had a sense of hope for the future, I wouldn't be doing this. And so, this whole area of wealth is such a huge one. And, we look at it in three ways and focus on, how do you help people to grow their household wealth? So the wealth of an individual, or a household, how do you enhance the wealth of a neighborhood? And then how do you work with communities so that their stories are told from a standpoint of their voice and their narrative, which is a huge part of how do you even reframe some of these issues around health, wealth, and the wealth gap. And so, we look at everything from home ownership to small business and entrepreneurship, the issue of debt, huge issue that people forget, the toll that debt takes on families, even if they're able to accumulate some assets. How do we make sure that neighborhoods where there's been massive disinvestment have incentives to invest in those neighborhoods? There's no big mystery why one neighborhood has no resources and another one has lots of them. It's because people invested in those neighborhoods. We can take that same investment and lift up neighborhoods where there's been massive disinvestment. So all of those are the kinds of things we're working on, and doing it in a way that recognizes, we're a foundation. We make grants to neighborhood organizations, but it's not just money or programs, it's policies, because poor policies in this country are what led to the wealth gap. Things like redlining, lack of lending, all these things where, if you were Black, your ability to purchase a house was close to nothing. And we know that home ownership is what built the middle class in America. If you had no opportunity to invest in a home, you're starting further behind. You're already starting further behind. And if your neighborhood is a neighborhood where there's disinvestment, so even if you own a home, the home doesn't appreciate, again, you're falling further and further behind. So we're looking at, what are the policies that could help to undo some of the harm and damage that's been done, and have the policies go hand in hand with the kinds of programs that we support.
As you speak, it makes me think, because you're right. The many years I've lived, we've always thought as homes are the way to build wealth, build equity. And as you say, many more non-Hispanic white persons have had the opportunity. Even if their incomes are the same, they'll get the mortgage. And there's such tax advantages to owning a home. So it's like the tax advantages are heading toward wealthier people, often white persons. So there's a whole history, like you say, of institutional barriers in many ways, like redlining around focus. I wonder, there's something coming in from Aaron Jordan. If we could focus a little bit on, everyone talks about literacy, but on economic literacy for young people, and actually even beyond young people, if I can add that. As you say, some people are exploited. They pay 26% on credit cards or payday loans. So they're being exploited. They can't get ahead because they're paying such high interest, or they're getting in debt. On the other hand, what a big what a big thing that you could be doing or others could be doing, trying to teach them economic and financial literacy at a young age or fairly young age.
Yeah, I think economic literacy, financial literacy, um, very useful, very important, and again, I look at it as something that is necessary but not sufficient. You can learn all you want about financial literacy, but if you walk in and you're Black and you can't get a loan, doesn't matter how financially literate you are. So that's why I go back to, I think we have to think about this from the standpoint not just of an individual, but that an individual lives in the context of a system.
Hmm.
And if it's a system that was created or perpetuated in ways that disproportionately disadvantage a group of people, it doesn't matter how much knowledge you might
Yeah,
have, you're
yeah,
still exist in a system. So I think, yes, teach financial literacy, but yes, let's change these discriminatory systems so that people, once they have that literacy, aren't blocked from getting a loan to get a house, aren't blocked from getting a loan to start or enhance their business, and on and on and on.
that's right. We could say, wow, this person is paying a high interest rate, but it might be because the banks won't lend to them. And studies, as you know, have shown, even based on the person's name, banks make assumptions, and others do, human resource departments. Here's a question from Thomas Heggie, who's a brilliant undergraduate. What do you feel is the proper role of the for-profit business sector in a pandemic to solve some of the inequity issues you've mentioned? I guess they could be health inequities or economic inequities, for instance.
Yeah, no, huge. I think the public sector has such an important role to play, and in a variety of different ways. First of all, who you hire and how you hire is important. How you promote, who you champion within your organization, who you put on your board of directors. All of these things I think are critically important, so that you have different voices sitting at the table, and you have voices and people who have the opportunity to personally, continue to create, to be able to create wealth and hopefully pass that on to generations. But I think who's at the table, how are you hiring, all of these things are critically important. But also, how are you spending your dollars? Um, do you use diverse suppliers?
Mm,
If you're a company and you have the opportunity to, in your professional services, hire lawyers of color, or in your advertising, uh, go with advertisers of color. If you need certain supplies, are you going to minority
mhm,
suppliers? So I think there's a whole other part of how companies spend their money. There's always so much focus on diversity and inclusion
mm.
internally, but
That's
then
right.
how are you also thinking about how you spend your dollars? Have you invested some of your money with a Black or brown bank
Hmm.
that is more likely to use their dollars for those communities? If everybody put just some small amount of their deposits with banks of color, that
Yeah,
would be huge.
that's right.
So there's so many ways in which I think companies don't think about their spend and how they're doing it in ways that can also help to generate and create wealth in communities of color.
Yeah. You're the distinguished speaker, but just one example. Delta Airlines here in Atlanta, as you know, where they're headquartered, where the airport is in College Park, is an area where there's tremendous proportion of Black persons, Black small businesses. And Delta once had me speak to their minority vendors, and there were 300 minority persons who all are vendors to Delta. And I think they had me speak to them about where the economy was going, because it showed Delta really wanted to make an investment in the success of these businesses. And I wish more would do that. How about at the Chicago Community Trust? Have you found ways to try to spur? I know your father was a small business owner, for instance. capitalists who can build wealth for their family within their community, maybe create jobs. Have you been actively trying to, if I can say, like, kind of create more little capitalists who can help wealth creation in their community?
Yeah, no, it's a big part of what we do as part of our overall strategy around closing the wealth gap is working with small businesses, entrepreneurs, and in a variety of ways. So, one is obviously if you're trying to start a business, you need capital. But oftentimes, even before getting the capital, people just need to be to know how to get a lawyer, how do you get a permit,
Right.
what's the right way to develop my business plan, what's the pitch, who are the people who are more likely to give me technical assistance around what I'm trying to do, who's already done what I've done so that I'm not making the mistakes all over again. So we work on both the ecosystem that allows for the kind of capacity building that oftentimes small business owners or people who are starting a small business may not have,
Hmm.
as well as working on how to get the capital. So once they have built out their business plan and are ready for that, they really are in good shape and will be able to use the capital well. So it's a big area for us, and one where we had a lot of success in helping to start small businesses and help develop and grow small businesses. Every large business was a small business
That's true.
at some point.
That's true.
So we don't want to just
Yeah,
say small business. That's where we cap it because you're a business person of color. We want to grow businesses
that's
too. Some will stay small, but we also think there's huge potential. And Chicago has a rich history
right. Oh, yeah.
of some of the most well-known Black businesses started in Chicago.
That's right. I think maybe even the most well known. And one thing I wanted to, actually, there was such a good question from someone I think you would be very interested. Maybe she could send you a little bit about herself. Florence Laurent. Are patchwork private programs in poor neighborhoods effective? Florence thinks of the late George Brumley's investment in Whiteford in Atlanta.
I don't know if I understand what patchwork private programs are. Do
Yeah,
you understand that term?
yeah, I'm not really sure either. Florence, if you could type in um, a little bit of more discussion. I'm going to jump ahead because you may know her. I hope I pronounced her first name right. I taught her. She was a brilliant executive MBA. Quadira, I think I got that right. Abdur Rahim, and I think she's now the chief diversity and equity officer for the city of Atlanta, if I recall. But anyway, so we're very proud of her here at Goizueta. But she asks, what role might innovation play in creating more equitable communities? And of course, she's
Yeah,
thinking about that on the Atlanta, front for herself and the mayor. Yeah.
yeah. Well, I think innovation plays a great role, and it can be either a great equalizer or it could be a way of furthering economic divide. And I think a lot of it is making sure that when there are innovations, that equity is thought of upfront. So we know the digital divide, as an example, is very, very persistent because we didn't think about what did it mean to make sure that there was internet access, more broadly, and that it wasn't just about ability to pay. So I think innovation can be huge. In my work globally, I have seen generations of technology and infrastructure leapfrog because of almost necessity. So in many parts of Africa, mobile phone and mobile payments were well established long before we went to mobile payments and mobile cash in this country. So I think there are many, many ways in which innovation can kind of leapfrog and can be used. A lot of the things that we developed in diagnostics that were appropriate for resource poor settings in Africa and Asia could now be used in resource poor settings in America. So I think there's a lot of innovation that could help us with this issue of equity, but it has to be not an afterthought. It has to be something that goes into the very design of it. And I think it's why it's so important that we get young people of color interested in STEM and so that they're the creators. They'll come up with innovations that will be relevant to them, to their families, to their communities, because they're the ones who are coming up with the questions and the solutions.
Yeah, I think you're right. That is one of the greatest developments over the last few years. There's anonymous attendee with a great question. What types of policies should governments first prioritize? I think the idea of the priority to tackle health inequity and also tackle wealth inequality. So some sense of priority.
So, I think there's I'll give you an example of one, and I will say, broadly speaking, there were many things that we did during the COVID pandemic because we were in crisis, because it was an emergency, that I think we could carry on today. For instance, the child tax credit, or also the earned income tax credit, giving family cash based on the number of children that they had. It's been shown that it's hugely important for fighting poverty. That if you give people cash, particularly poor people, they know what to do with it. There's always been this idea you can't give poor people cash because they'll spend it on things that are not in their best interest. Well, if you're poor and you get money, you're going to spend it on the things that you most need. You're going to spend it on food. You're going to spend it on rent. You're going to spend it on the things that keep you and your family out of poverty. And so I think there's a lot of things like that we saw during the pandemic that we should think about carrying over. Earned income tax credit is another one, hugely important, giving working families additional cash that just gives them that kind of financial stability that is critical and important. So I think there's a lot of ways that the government could look at these policies that are intentionally meant to help struggling families. Health, on the health side, clearly we need to have the ability to pay, which Obamacare went a long way in that direction, but I think we still have a ways to go so that everybody has the ability to access health services. But we also need to have a system that's more well knit together, that really has the individual patient in mind and doesn't make it as cumbersome for people to put together their health and their health care. So, those are some things that I think we could work on, but we know they're doable. It's really about the will.
That's right. When we did have the child tax credit up to a few months ago, poverty was down and many metrics were up. And there was that article, what do the poor need most? Cash. And like I say, studies have shown they'll maximize the use of it. I'm going to ask another question that was sent to us, and I will have a little more personal ones for you. This one, I guess we pretty much touched on it. So I'll move away. Basically, we pretty much touched on both of these. One, we'll go a little deeper. If we had a universal basic income, would that be what you would consider the most, where everyone gets, some money from the government? Would that be the most appropriate thing you think to deal with the social determinants of health, things like food insecurity, unsanitary or unstable housing? Or are there other things that you would like maybe more targeted on some of these social determinants of health?
Yeah, so I'm a big believer that if people don't have money, then giving them money is a good thing. Yeah. And we're actually doing a pilot here in Chicago of a basic income, $500 a month to $3,000 for families. and we'll evaluate the experience, but the experience where it's been evaluated so far shows that if you give people cash, it makes a huge difference in what they're able to do for themselves and for their family. I distinguish guaranteed income from universal basic income, because I do think that one has to question, is somebody who's making $250,000 plus, or even more, do the billionaires, strictly speaking, universal basic income means that billionaires get a stipend just like somebody who's living in poverty. So I think that there should be some distinction, there should be some differentiation. But I do believe that giving people who are living on the margins, who are financially unstable, cash to be able to take care of some of their basic needs is critically important.
Yeah, and you mentioned the earned income tax credit. I want people to know that as you know, it actually came in under Ronald Reagan, under a Republican. It's an idea whose time should come in a nonpartisan way, and it's basically like a negative income tax. If let's say you have kids, like you say, but your income is very low, instead of paying in tax, you get some money back. Yeah, so I think you're absolutely right there. Now, Florence Laurent, who was again asking about I'll read the question again, but she's making a good point. Are patchwork private programs in poor neighborhoods effective? So she's thinking of the late Dr. George Brumley, who was, I think, a wealthy doctor, as I recall, who put personal investments into this very poor area, Whitehead in Atlanta, but Whiteford. But then she expands on it later. What she means is, by these patchwork private programs, private investment by doctors or by business people to create something of a foundation, and like focus on a community, like he focused on Whiteford. And it could be you or me or you as a board member of Coca-Cola, coming into these communities and trying to do something.
Yeah, well, it's complicated. You never say it's a bad thing for people to try to do something for a neighborhood. But I think it's important to think about what will last. Are these sustainable solutions? Who is at the table when the decisions are being made? If I swoop into a neighborhood and it's not my neighborhood and I don't know the neighborhood, but I got a bright idea, is that actually going to take hold? Is that going to outlast me or not? And I do think it's, again, this mix of policies as well as programs. That's right. And I think we still need to think about the systems that people in neighborhoods live in, and are there more things that we can do to push on our policy frameworks? Another example of a policy that started having legs, but is baby bonds.
Oh yeah.
This whole idea of children, particularly children in poor families, get given a certain amount of money every year that would be the equivalent of my parent doing a savings account for me that gains interest, and by the time I'm 18, I actually have some money I can send. I can go to school. So these baby bonds are, and then there's child savings account. They're all kind of variations on the theme, but they are saying, let's in some ways mimic intergenerational wealth creation by actually providing some dollars for children to be able to accumulate over their 18 years. And everything that's looked at that has shown that it has made a huge difference. Even just putting a small amount of money in a savings account for a child, that's right, and not continuing, shifts the thinking for that mother about that child and that child's future. They are more likely to go to college, et cetera. So I believe that some of the neighborhood type projects that people have done are good. It's hard not to say somebody who has resources wanting to do something, but I think we've got to think about it in a holistic way. And I don't think that patchwork projects are what is really going to change the situation around health, or around wealth.
No, I agree. And we'll let you off in a few minutes, but there's a man named Jose Cisneros who's treasurer of San Francisco, and you probably know him, but he's on the board of this Robson program. And one of my closest friends, and he started this idea of child savings accounts, and he would go to Bank of America and these other big banks, and maybe they would put in $100. He, as treasurer of San Francisco, would get San Francisco to. The family would put something, and as you say, it changes the mother's expectations for the child, but also even the child's expectations when they get their account and they see it going up. And Jose has exported that idea to something like 125 cities, and he has spoken to my class and in this Robson program. So I think I recorded. So I'll share that with people listening because I think Dr. Gayle showed how important that kind of systemic program is. Dr. Gayle, in the 2 minutes we have left, you've succeeded at so many things, and you have deep friendships around the world. So many doctors you have helped train, programs in Africa you and I have talked about. You're still a nice person despite all this success. Could you give the people on this call, many of them are students, your kind of, if you could use one or two words that you think could contribute to them being success. And like you say, you're a success in your career, but in so many ways, and you're a significant person as well. What are one or two words that you think have led to your success, your significance?
Well, I guess having a sense of what you think your purpose in life is. For me, everything I've done, even though I didn't plan much of how my life evolved, but the thread was always, my sense of what did I feel I was put on this earth to do. And, for me, the issues of equity and social justice, whether it's focused on health or whether it's focused on economics, has always been, what I wanted to, see how I wanted to make a contribution. I guess the other couple of things, being curious. I am infinitely curious, maybe too much because I always end up involved in so many different things. But I think keeping a curious mind, being interested in the world around you, and then I think maybe being willing to take some risk, calculated risk, but step outside of what seems comfortable, step outside of what might have been expected for you to do, given what you're currently doing, and being willing to take a little bit of risk and do something a little bit different than what might have been predicted.
Yeah, and you have moved to different places every 7 years, 10 years, and done something new to help move the world forward. In our last minute, one thing I'd like people to think about is I know that like I say, your father was a small business person. I think your mother was something like a social worker or something.
Social worker, yeah.
Yeah, and I think we can see in you that idea that business, for instance, can move things forward, or economics is important and efficiency, but also we live in a society, and for instance, businesses that have some social purpose. So I think you've done a wonderful blending of that. The other thing I want to bring up is that you're a pediatrician, and I know you went to a great medical school at UPenn, but I believe, and you can tell me if I'm right, that you thought, this is great, but I'm working one baby at a time. That maybe, like you were talking about systems and the systemic nature, maybe if I can go into public health, I can be so much more useful for so many young people. Is that kind of a fair interpretation of some of your path?
No, totally. I love taking care of kids, and I still love being around children when I can. But you're right. I mean, when you're a clinician, you're patient. You take care of patient one at a time. When you're a public health physician, you take care of populations. And I, knew that I wanted to have a societal impact in whatever I did, and it's why I gravitated to public health.
Yeah. Well, I think you've made a huge impact on the world. And on behalf of Dean Karen Sedetall and our Goizueta Business School Learning and Leading series, we couldn't be just more pleased that you have a connection to Emory. And I know You have connections to the Rollins School of Public Health. You have an honorary doctorate from Emory, amongst 18 honorary doctorates. And I know you lost a very, very close friend yesterday, one of the other great leaders in public health, Paul Farmer. So thank you for taking this time, especially at a time like this for you. And I must say, on behalf of Emory and myself, we just admire you, Dr. Helene Gayle. So thank you so much.
Thank you. Thank you, my friend.
And look forward